Remember to sign your names into the chat and to keep your cameras on, please. So we just have one quick announcement before Scott actually does the introductions. At the end of every seminar is when me and Joel will go over any updates and news announcements for the program. So do not check out when the speaker is done. We will always have something to talk to you about. So make sure you stay on when we're done with the speaker. And Scott, if you are ready.
That's great. No, thank you, Lisa. Can you hear me okay, Lisa?
Yep.
Great. So welcome, students. We're very fortunate today to have as a speaker Rebecca Dissler from the Patrick J. McGovern Foundation. The Patrick J. McGovern Foundation is a leading global foundation looking at applying AI and data science towards some of the most challenging societal problems. Within that context, Rebecca leads their efforts focused on global health initiatives, working really across the globe, Latin America, Africa, multiple countries, looking at how to increase global health, leveraging most recent advances in AI and data science. Rebecca has pretty extensive background. She's worked in this area for many years. She comes from Yale University with a master's and bachelor's there, and has a number of accolades. She's a team member of the Council on Foreign Relations, a World Economic Forum Global Shaper, and was recently selected as a Forbes Ignite Impact Fellow. So we're very, very fortunate to have her today. And sort of as a bonus, we also have Vilas on the line here as well, who is the president of the PJM Foundation. We're very fortunate to have both of them. The Patrick J. McGovern Foundation has been a great supporter of BWSI Summer Institute for a number of years, and really helps us reach out and impact the most number of folks that we can. So please ask questions in the chat. I'll keep an eye on that. We're going to do Q&A after the discussion with Rebecca today. But I feel very, very fortunate today to introduce Rebecca to you all. Thanks.
Thank you, Scott, for that wonderful introduction. Good morning, good afternoon, everyone. I am so excited to be here with you. I've really been looking forward to this. Vilas has shared so many wonderful things about this program, so it's a real pleasure to be here with you today. As shared, the Patrick J. McGovern Foundation focuses on advancing data science and AI for public good and social impact. We are a distributed team. I'm coming to you from New York, and you'll see we work on a wide range of issues. As shared, I've spent that last decade working with governments, nonprofits, technology companies, and foundations to ensure innovation from early stage research to technologies like AI are used to improve healthcare around the world. We'll kind of talk about what that means. So excited to join you here today to talk about our work at the foundation, to provide a deeper dive into some of the work we do on health, and then just to share some reflections I think that we're learning along the way and honestly continuing to learn in this space. So with that, I'm going to share my screen. Hopefully you all can see that, and we'll get started. So I kind of want to start with a simple but really foundational observation, right? Which is that data and AI solutions are already found in everyday life. If you have used Google Maps recently, or clicked on a recommendation on Netflix, or watched a TikTok video that was recommended for you, these are tools that are powered by these underlying technologies. If you open an iPhone with Face ID, if you have that, if you're online shopping and you see that kind of personalized experience. And these technologies make these experiences more efficient, more accurate. They create sort of that delightful consumer experience. They keep us engaged. They nudge us into certain behaviors. But those very same technologies also really have the power to meaningfully advance social progress and on some of the toughest challenges that we face as a society. So there's a lot of folks on the line. I don't know if we can really do a show of hands, but I would be curious to know how many of you have heard of something called the Sustainable Development Goals. And I'll do that brief kind of, I see a couple of hands raised. All right. So then you know that these were, or for those who may or may not know, these were launched by the United Nations in 2015, and they are 17 goals that lay out really a big, bold vision for a more just world, and kind of that blueprint for how we get there. And I just share them here today because it is sort of a high-level framework of how we think about social impact and sort of organizing some of those challenges that we see: quality education, zero hunger, clean energy, health, and well-being. But it also starts to give us a framework for how we think about that intersection of social impact and these challenges and data and AI. So, for example, those algorithms for prediction that instead of predicting, what show you are likely to watch or video you're likely to click on, may be able to help us predict energy demand or crop yields, or survey communities for clean water and help us think through how we can better allocate resources toward communities most in need. And I think something that we think about quite deeply is that if we want these technologies to have that impact, it's critical that they are both built and deployed responsibly and ethically. And so for us, that means looking at how do we support the kind of creation that looks at that collaboration to advance technology toward common social good, so toward addressing some of those challenges, that we ensure that these tools don't reflect the biases and inequities that exist in the world and as we see them, but are intentionally designed to address and mitigate them or protect against that bias. And that in doing so, we advocate for a representative and diverse workforce, the folks who design, deploy, interact, benefit from, use those tools in real world settings. And so those are the sets of questions that we set out to ask at our foundation. As shared, we are dedicated to advancing artificial intelligence and data science solutions with that goal to create that thriving, equitable, and sustainable future for all. We believe, and just very, very deeply, that this kind of technology can really amplify the best of our community. What makes us us, our creativity, ingenuity, curiosity, kindness, and generosity. And so when we think about, well, how do we go about doing this? How do we look at some of the most innovative technology and some of the most pressing challenges? There's kind of a couple of pillars of our work. And I'll share those in a moment. But before I do, I think something that we recognize, right, is that the world may not look like this today, but we do have a vision for where we could be going in the future. So when we look at some of those technologies today, I think there's a recognition that they're oftentimes created by technologists or academics. We see sort of varying levels of the way our policymakers engage with these technologies. And something that I really appreciate, but we talk about this technology not being necessarily in the wrong hands, but in too few hands. How do we increase access, knowledge, understanding, engagement on these solutions? And within that, if we can start to address these, then we can start to do what we really think about is architecting that shared digital future. So that world in which the accelerated applications of AI can maximize our human potential, can address some of those challenges that we saw in the Sustainable Development Goals. We can advocate for dignity, good data stewardship, and ethical use of those technologies. And I think particularly something we look at is how can we strengthen nonprofit and civil society in using those tools to advance their goals. And so, as shared, how do we actually go about doing this? And I'll kind of provide a brief overview of the work. So there's certainly the work that we do in strategic grant making and focus areas. We're about to do a deep dive on our health portfolio, but we also look at data infrastructure in climate change and climate resiliency. We look at the workforce itself, and how do we support data and digital literacy? How do we look at democracy and ethical AI? We've got a team, our data and society team, that really focuses on bringing the power of data and AI to the civil sector, that focuses on working directly with organizations on their data journeys. And that accelerator program that we run offers a mentorship and a cohort learning model, not unlike the cohort learning model right now, as well as providing equitable access to some of the platforms that enable that technology. And then we do what sort of a kind of a power of being part of the civil sector, which is bringing together really diverse perspectives to kind of talk about some of these challenges and how we might be able to address them in partnership. So how do we convene leaders from policymakers and companies and nonprofits and civil society and human rights activists to come together, and how do we use that platform to amplify our grant partners' work. I'll share, I mentioned we are a distributed team. Our work is really distributed. And I think something that is really special about the work we do is that we're really driven by how do we support our partners' potential for impact without that geographical restriction. I'm actually going to close this for a moment before we get into our case studies, because we are going to dive into a little bit of the data to improve health. But I want to pause here for a moment and come back to you all. Let's do this so that I can actually see who I'm speaking with. And I want to pause here because before we get into how we use health and data, I really want to share a kind of a personal story with you. So when I was a senior in high school, when I went to college, I had no idea what I wanted to study. I had no idea what I wanted to do when I grow up. I sometimes still think I don't know what I want to do when I grow up. And I had really early advice that I took to heart, which was, you're going to have great opportunities to be in classrooms and learn in a classroom setting, but find opportunities outside of the classroom to engage and learn. So I took this advice and I went to a lunch with a professor of public health. I had never heard the term public health, but I really wanted to learn more. And I went to this lunch as a freshman, and she opened her talk by showing us this image, and I'll come back to it now if I can switch back and forth as, there we go. So she showed us this image, which I hope you can see here, or an image like it. And the way that she described this image was, if you imagine disease and sort of poor health as this overflowing stream of challenges, right? This tap water that is sort of flooding a room, for example. And to stop that water from overflooding, you need sort of two really important types of people. You need folks who are on the front line, mopping up the floor, trying to prevent that stream from getting worse. And she pointed to that and said, this is roughly sort of how we think about the field of medicine. And then she pointed to the tap itself. And she said, at the same time, you need people who are trying to figure out how to turn off the tap. The root causes, the often systemic challenges that lead to the water running, that health event in the first place. And the set of actions around turning that tap off, sort of what we might call a systems approach, that's the field of public health. And and this is how we define it. And that, to me, that was a moment as a student where I remember thinking, that's a really incredible approach to trying to solve some of our biggest challenges. I want to learn more about that approach. I want to learn more about how we can design our systems and be part of the effort to try to turn some of the tap off. So that was a real moment, for a real turning point for me as a student. So when we think about public health, and this is sort of your very brief crash course, frankly, it's a topic you're probably more familiar with than you think, having lived through and continuing to live through a pandemic. We talk about it as the science and the art, which I've always loved, of preventing disease, prolonging life, promoting health. But it's a whole, as a constellation of actions and systems, informed choices, organizations of society, organizations, public, private, that come together around this. So you have seen things around monitoring outbreaks and case counts. You've taken part in health promotion measures around face masks and washing hands and social distancing. You've seen how we've monitored for new strains, introduced new vaccines. And so a lot of the work that are the three examples that I'll share to you today of our work are really focused on how can we use technology to advance these goals around health promotion, around disease prevention, and around how we engage in and help folks sort of, as shared, prevent disease, prolong life, and promote healthy behaviors. So what I'll do is share three examples of the work. So these are work that some of our grant partners are doing. I've picked three examples in three different countries in three different areas of public health, just to give you a really broad sense of how these technologies can advance these goals. So the first example I'll share is an example that comes from an organization in Brazil that works with women, low-income women, and provides breast cancer services around breast cancer. One of the things that, just to share for context, breast cancer has up to a 95% survival rate if it's diagnosed early and treated properly, but it still remains one of the leading causes of death of women in Brazil, in part because of this late stage diagnosis. Now at MIT, There's researchers who have piloted this new AI model that they think can predict the risk of developing breast cancer by up to 5 years earlier. And so the partnership that we're really supporting is between the team at MIT and the nonprofit in Brazil around, well, how could this technology improve the way that we provide services to women, low-income women in Brazil? And I'll share this quote with you. That's actually the Washington Post article about the MIT algorithm that described it as a marriage of tech and healthcare that could alter millions of lives without a single drop of medicine, which I thought was a really powerful way to describe that kind of, that sort of technology intervention. The second example I'll share comes to us from Malawi and is focused on vaccine delivery. So as many of you know, vaccines protect millions of people from infectious diseases. There's any number of vaccines that we provide globally for several diseases, and particularly for infants and children. But what you may know or may not know is that many of those vaccines need to be maintained and delivered at a very precise temperature if they're going to be effective. So imagine that you are delivering a life-saving vaccine, but by the time that it gets to your health center, because along the way, the temperature has been too hot or the temperature has been too cold, by the time it actually arrives and you are ready to provide it to a child, you can't anymore because it's been boiled by temperature. And so that was sort of the problem that Nextleaf Analytics, one of the problems that they had set out to solve. It's a nonprofit technology company. They actually build sensors that you can put on the vaccine fridges and sort of do that remote monitoring of temperature to make sure that vaccines do arrive at the correct temperatures and thus maintain their efficacy. And I think something that Nextleaf is doing that's really interesting, particularly in Malawi, is they're working with the government, or the Ministry of Health in Malawi, and the government officials who are in charge of the vaccine program to say, we're not just going to deploy the sensors, and we're not just going to provide you with the dashboard that gives you this data. We're also going to work with you to understand how to use that data to make decisions that can really make sure that these vaccines reach those who need them the most, and that when they do arrive, they have been maintained at that temperature and can actually be effective in preventing disease. And something that I'm always blown away is that the innovations that Nextleaf builds can protect the supply chain for 1 in 10, or protects the supply chain for 1 in 10 babies born each year. The third example I'll share comes to us from India. It's our partner is Khushi Baby and looks at maternal and child health. I'll share up front, one of the really cool things about this organization is that it was started by a young man when he was an undergraduate in college. And so this has since become a nonprofit doing really excellent work. One of the things to kind of share sort of from a global health context is that many countries utilize cadres of health workers called community health workers. They are often women. They often come from the communities in which they serve. And many of them go door to door and provide services for mothers and their children, nutrition, malaria, sort of a set of interventions around pregnancy. But these healthcare workers often have limited resources. They often need to refer those women for more specialized care. And so Khushi Baby had originally developed digital tools to help community health workers manage patients, track the women in the community, collect health data, and use that to kind of manage the program. And as they were doing that, realized that they really did need a way to be able to say, okay, who is at risk and who may need more care? How do we refer them to that specialized care? How can we use the data on these tools that community health workers use to help them make better decisions around caregiving? And so that's what they're doing now, is using the data that's collected from those community programs to create algorithms for who is at risk of dropping out of care, who may have a risky delivery, or their children who are at risk, and how can we use that data to provide more targeted caregiving? Now, those are 3 very specific examples, 3 countries, 3 health areas. And the point that I wanted to bring here today is certainly to do a deep dive into public health, which, if you can't tell by my enthusiasm, is an area I am deeply passionate about, but to also share that the lessons that we learn and the ways in which these partners use technology have lessons for us no matter what technology we use and no matter the issues that we choose to work on and engage with. And so when I think about these 3 different organizations, 3 different countries, 3 different challenges, I feel like there's learning questions as shared that, that we, no matter what area you work on, I think are relevant. When I think about the work of INSTITUTO PROTEA, I think about how do we ensure that technology, whatever it looks like, reaches those who stand to benefit from it the most, and the kinds of partnerships, questions around access and availability that kind of arise when we start that line of questioning. When I think about some of the work of Next Leaf Analytics, I think about how do we ensure that the technology we build then is actually used to create that impact, right? That sensor is really important, but so is the decision we make with the data that sensor generates. And so what are the sets of things we need to do to engage folks who are using the technology to make sure that it does get used for impact? And then when I think about the work of Cushy Baby, and I should share this is true of so many of partners, and frankly, all the partners on this slide, which is that how do we ensure that technology is designed by and for the communities that will use it? We're not designing solutions outside of those communities. We are engaging them. We are working with them to have those tools, to use those tools themselves to generate knowledge, to deploy them, and to do so in a way that is in service of furthering whatever that social impact is in their communities. And so my sort of challenge to the group, right, is whether it is health, whether it is climate change, whether it is social justice, education, more equitable workforce, there's always sets of questions that we can ask about the kind of change that we want to see. We often at our foundation talk about our purpose. We talk about where our purpose comes from, the communities that we belong to, the challenges that are facing those communities, and where we see opportunities for impact. We talk to partners who are from those communities and work to understand where those partners see that opportunity for impact. I alluded to my passion for public health, but I to ask those questions again about, well, where are your passions? And the questions I ask are, what do you want to learn more about? I think we always ask about what excites you, which I think is an important question. I also say what puzzles you, like what are the things that you want to solve and figure out? And certainly in doing so, how can you apply technology to support your communities in that work? And I think something, if I may, something I wish I had learned earlier, if you will, in my career, was that it's not so much about where you do this work, but it's really about who you do it with. And so when you think about this incredible cohort of students that you're with, these are the folks who are going to be your peers, and you're going to enter you're going to enter schools, you're going to enter the workforce together, you're going to continue to learn, you're going to be in very different fields. You're going to find mentors in those fields, maybe academic or otherwise. As you move into workforce, you will work for managers and for bosses. My boss is on the line, and so I get to embarrass him by saying that one of the things that I love about our foundation, as you can tell, is the work we do and how we do it, but also the people that I get to do it with. And that's something that makes this work special. It's what Vilas has created for us at the foundation. Getting to work with him, getting to work with our team, and getting to work with our partners has been really, really extraordinary. So with that, this is a whole slew of contact information. If you want to reach out after this conversation, that barcode will take you to, hopefully, I believe, my LinkedIn profile. I don't know if that is where you are engaging in building up your networks, but encourage you to potentially have that start there. But you can email me, you can find out more about our work online, and follow us on Twitter. So with that, I will end the presentation and happy to open it up to questions about our foundation, our work, career building, network building, and thank you again for the opportunity.
That's great, Rebecca. It was a great talk. It's amazing the amount of space you cover, honestly. So there are a number of questions in the chat. I'll get to those in 1 second. I'm going to take my my liberty as the moderator to ask you a question off the top, then I'll go over those. You're covering such a global area, and then public health is such a large area too. How do you find these companies, right? I mean, it's like small companies working in India doing something that, how do you find them?
Yeah, it's such a great question, because I think we are constantly thinking about where and how those connections are made. Something that's really interesting about our foundation, I didn't even get a chance to cover it here, is one of the things that we try to start with is an understanding of the space. So my role is strategist. I really work to help us understand some of the challenges and opportunities within global health, particularly the intersection of global health and technology. And as we start to really talk to folks who are working in the space, we talk to academics, we talk to policymakers, we talk to implementers, we attend conferences, we read reports, which I feel like hopefully there are organizations who put out these reports and landscapes and mappings, and we start to really uncover patterns, right? Where do we see areas that we think we want to learn more about? Where are folks pointing to case studies and examples? And then we talk to people and we ask questions. There's one of the things that we then try to do is look at our strategic pillars. And as we are exploring and kind of talking to different organizations and talking to different partners and tapping into lots of different networks, right? Folks who have been funded by large donors, folks that have maybe only worked with technology companies, folks that come from an academic institution, we can start to map and say, which of their ecosystems are you playing in? How might we intersect with you? And I think critically, how is the work that you're doing really aligned to some of the questions that we're trying to ask? So perhaps to borrow from public health, it's a bit of an art.
Yeah, well, that's great. And we have a lot of questions in chat, so I'm gonna try and sort through a few here to pick out a couple to give you. I'll have a student unmute and ask the question if possible. So Daniel Kim, did you want to ask a question?
Yeah. So my question is, how are researchers mitigating the regressive risks of algorithmic bias, biased historical medical data, and physician bias? And will AI remain a tool and not a substitute for doctors?
I'll start actually with your last question, because I think it's important to walk backwards from that, right? Something I feel really strongly about, and coming, I should share, from a public health, not necessarily an AI background, but having worked on that intersection, is that we always need to start with the problem that we're trying to solve, right? And in public health, these are challenges of healthcare, right? It's a very, it comes down to a very personal interaction. And so when I think about questions of replacement, to me, is the problem that we're trying to solve answered by replacement, or is it solved by, we have folks who are in these roles who we can help them be more efficient, we can help them, frankly, spend more time with patients and trying to solve some of these human challenges. And I think that's really important, right? How do we, particularly within health, ensure, we sometimes talk about like the person in the loop. It's really about people, like humanity in the loop. So I feel really strongly that it's not so much about the replacement and automation, which are, I think, underlying powers of these tools, but really the applications of what are the challenges that we're trying to solve with them. I think with the questions of bias within data itself, I think this is an area where, the short answer is yes, there are folks that are actively looking at this. And I think this is an area where that interdisciplinary collaboration is really important. In an earlier slide, I'd sort of flashed it was a headline. And it talked about the bias against Black patients in an algorithm that was deployed. And that was because that the way in which that model was trained, the data that was fed into that model essentially looked at sort of care utilization and cost without taking into account that white patients, because they receive more care, actually end up spending more money. And this was in the data set. And so what it meant is that this was an algorithm that was trying to help doctors figure out who to spend more time with. And it sort of used the wrong metric to kind of figure that out. Now, that's something that you need folks who understand those underlying determinants, why someone seeks care. Why is it that a certain patient spends more on care? It's not necessarily because they need more care, but it's about access to that care. And that gets reflected in the data. And so there's nuances of that require folks, and I should say early in a product development cycle, right? Coming together, not just around the data, but around how we actually understand what that data reflects, what it doesn't reflect, and what are the things that we can do to mitigate it. So that's earlier stage conversation. It's time and resource intensive, but I think that there's a whole group of partners that are really committed to that level of conversation and analysis. And I think that's an area that's really exciting and where certainly I hope to see more of.
There were a couple questions about in the area of sort of communication and trust establishment. So Amruta, I'm hoping I'm getting that name right. Amruta Dharma Purgar.
That's me, yeah. Yeah, my question was just like, how do you overcome barriers of trust and like establish communication between yourself and the communities you're trying to impact, especially when they're like not, when they're like from different parts of the world and stuff?
Absolutely, absolutely. You know, and having worked in global health now for a decade, a lot of times, and I'll just say personally, the way that I see my role is not about coming in and sort of coming in with an agenda or a set of recommendations. It's really actually about identifying the champions in the community and thinking about how do I support them in leading the agenda, in driving that work. And I think this is something that many folks in sort of the global health space are trying to actively do more and more of, recognizing that you may have resources, you may have connections, you may have certain areas of expertise or grant proposal writing skills or a sort of a network, and thinking about how can I leverage those resources to support a community champion. So I sort of personally, I don't see myself as that expert who would go into the community and help and certainly design a program, but to think through how do I use the resources at my disposal to support them in leading that work. And I think something we hear a lot about is co-creation, right? So co-creation between technology companies, between communities, between organizations. And I think something that's really important to keep in mind is who is leading that creation, right? And who is going to be in the driver's seat of it. And certainly something that we aim to do in our foundation and within our work is really ensure and continue to work toward ensuring that that is community-led and driven.
That's great. I think we have time for another couple questions. Logan, there's been a few questions about sort of where technology is going in this space. So I was wondering if Logan Reich, do you want to unmute and ask a question?
Yeah, sure. I was asking sort of what do you think the next steps are for the technology that you're using and like the implementation of it to help all these communities?
Yeah, absolutely. And you hit the nail on the head with that word, which is implementation. I think something, and I've worked with, prior to my work at the foundation, was working actually at a private company that was building AI solutions from the ground up. And so kind of got a deep dive into working with an AI research team from everything from data collection to model training to implementation. And that was where I think my own interest really is understanding implementations of this technology. So I had shared a little bit of it at the beginning where we still see pockets of this technology sitting with technologists, sitting with academics. And when we start to think about, well, what does it take to implement this in a workflow, in a community, in a public health setting? Those are the questions that I think we should be asking earlier in product development cycles. And I think we're starting to get there, but I think that when we start to, and it goes back to, there was another excellent question here around the sort of are we replacing or are we amplifying or augmenting? And that's what I think about. I think about the power to, we think about what these technologies are good at, whether it's risk stratification, whether it's, predictive capabilities. These are all things that still require us as humans to use and implement and trust. And I think that that's the piece that if we can figure out how to do more around, that's where we're really going to see some of the acceleration. So that's certainly where some of my personal interest lies.
Great. Castile had a couple of good questions there about sort of top-down, bottom-up thinking in medical spaces and how to address some of those issues. I don't know if you want to unmute Castile and elaborate a little bit.
Sure. So I was kind of very interested on the kind of the societal part you mentioned. Like you mentioned earlier about systemic issues and things like that. And I was wondering, well, I heard you talk a lot about, which I find very interesting, investing in smaller organizations or technology-based organizations. How you as a foundation or foundations in general, because I'm not too I don't know too much about them, can have more societal impacts, or how they can invest their resources to have more societal impacts, and whether they how they weigh the options of focusing on smaller communities and smaller projects versus more systemic or larger organizations.
Yeah, absolutely. It's an incredible question because it actually hits at a number of topics, and I think shifts in the way that we think about philanthropy, in the way that we think about global development, and certainly international aid. And I think that, something that, I'll come back to, something I sort of shared earlier about how do we identify community champions and advocates. A while back, I used to work on a program called Grand Challenges, which funds early stage R&D in sort of and academics and research institutions around the world. And it had this kind of tagline that I always really liked, right, which was that innovation can come from anywhere, but it really sort of especially comes from those closest to the challenges at hand. And so I think there's absolutely that recognition that we do need to find a way to support those closest to the challenges at hand, to ensure that they have access to the kind of technology and tools and training and opportunities to use those tools to solve those challenges. And I think within that, it does mean what constitutes and sometimes can be taking a bit of a risk. You have organizations that have only been around for a few years. You have organizations that have really small teams. I think something that's really interesting and I really appreciate about our foundation is we'll look at a team of 7 or a team of 4, and we look at organizations that have teams of hundreds, maybe even thousands. And we can look at both of them and say, well, we think that each of them are driving impact in meaningful ways. How do we ensure that we are driving resources? And even if you're a team of 4, you're not necessarily competing against the larger organization that has teams of thousands. We're really focused on what is the work that you're driving, the partners you're bringing to the table, how you are engaged in the community, what your leadership looks like. And that's a bit of a different model. And it's one that I think there are other folks in philanthropy who are trying to do that. And I think the needle is starting to move. But it requires a little bit of different thinking about how you, as you said, Scott, you had a good question about how you source the grant, how you make the grant, how you manage it. And I'm really proud of the work that our team does, certainly on the programmatic side, but also on our grant management side, to make sure that that small organization can really engage with that, really engage with that kind of funding mechanism. So there's a lot that goes into it, and it's about being, again, really intentional and putting the resources behind it to do it right.
Thank you very much.
Of course.
Great. G. Simmons. Sorry, I'm bouncing between monitors here. Had a question. I don't know if you want to mute and ask it about learning across from various communities you work with. Go ahead, G.
All right. My question was just that, have you been able to integrate the knowledge that you use or that you've learned in one place and take that and apply it to another place a lot of the time?
Yeah, I mean, I guess it's a really interesting question because it's in some ways it's what do you mean by knowledge, right? By experience. I think something that's been really fun, and I shared at the beginning, I've worked at private companies that have sort of one way of working in a structure. And I've worked with and around nonprofits or with foundations and governments. And I think that certainly there's a lot of really interesting conversations around what are the lessons from private sector that nonprofits can take in terms of management, in terms of business models, in terms of the way that they think about their platforms. And I think I'll actually share, I think in the technology space, particularly within health, there's a lot of focus on how we pilot technology. And oftentimes they're really designed as projects, right? They are designed to understand how the technology works in a particular context. But what we really need to do if we want to scale this technology and I think really accelerate the potential for impact, I think that we need to be thinking about them a little bit more the way we think about products and platforms, right? And so there's a great organization called Damagi that says this, and I always love this quote around when you think about it's for the potential for impact, it's not about getting to scale, right? It's about improving and running at scale. And the knowledge it takes to improve and run at scale can be different than the knowledge it takes to have a successful project. And so there's all sorts of process innovations and knowledge sharing that I think can happen in that space, that before we even begin to talk about the applications of technology. And then I can certainly say, I think something that I think there was actually, I saw a question in the chat and I may just preemptively answer it around, like, how do you decide where to work and who to work for, and you sort of like try different things. That's something I've really enjoyed, is being able to say, what is it like to work for a VC-backed company? And what does fundraising look like at a VC-backed company? What does fundraising look like at a nonprofit? What does grant making look like at a foundation, right? And because you get these different perspectives, and that knowledge is in how you communicate, how you build partnerships, how you design those projects, but hopefully more towards scale. So I've really enjoyed the different knowledge exchanges and experiences that you get just by working with folks who think a little bit differently than you do.
I don't think we're gonna hit all the questions, but I think it'd be good. Amber Lowe, you had one question, which I think is a good one to kind of finish up with.
Yeah, I was just curious if there's any, because this is certainly a field that I want to go into. I'm very curious about the ethics of AI.
Yeah.
So your team, like, do they research it, or like, how do you go about like doing the ethics of AI?
Yeah. Oh, it's such a great question. There's so many ways in which we engage and which you can engage in the ethics of technology and ethics of AI. I think a couple of different things. So certainly at our organization, we often are working in partnerships with organizations that are driving this work. So I think quite similarly to some of what I've been sharing around how do we find the community champions within the global health space, it's thinking about who are the leading researchers, the folks who are on ethical AI. How do we think about supporting the institutions that are driving those research, that are creating the resources, that are working with policymakers to understand the implications of the technology. And I think that, when we think about ethics and AI, no matter what you work on in that space, you have a seat at that table, or you should have a seat at that table, and you have something to bring. If you're going into political science and you're thinking about policy making, right? How do we ensure policymakers understand these technologies, understand sort of the challenges around, or both the opportunities, but also challenges around human rights? Is it looking at human rights organizations, right? That focus really concretely on protection of human rights, and then are starting to think through how does that expand into digital rights? Is that working directly with engineers and data engineers who are thinking about those data challenges, who understand the data sets themselves and the sources of data? Is it working with public health experts, right, who can say, are you pulling data from these sources? How do we take a look at, well, what's represented here, what's not missing? Each of those tracks are different disciplines. They are different organizations. Some of them could be private, some of them could be public, some of them could be civil society, nonprofit. But a lot of it is figuring out where those start to intersect with one another. And so for us, as shared, we look at lots of different organizations that work on this from lots of different vantage points. But to your kind of question about how you get involved, whatever topic or whatever subject it is that you choose to go into, take the courses on ethics and bioethics, right? Join those clubs, engage, like have conversations, and start to create, that own community of folks that are thinking about this from lots of different perspectives. And then there's any number of think tanks, institutions that are also trying to weave that together and put forward concrete outputs. So a mix of practical and mapping. Okay.
Rebecca, may I jump in to just build
Please.
on the answer? Hi, everyone. As they said at the top of the call, my name is Velastar. I have the real privilege of working with Rebecca on some of this. And Amber, I wanted to come in just to speak directly to your question because I thought it was so important. And I just want to say one thing that I hope you'll all hold with you is all of these topics that we've talked about today are really in their infancy of formation. These technologies are being built around us, but much more importantly, the policies about how they're governed, about how they're used, are being developed. Today is day zero. And so what I want to leave with you is I want every single person on this call to realize that you have ownership and agency not just to ask where is the work being done, but to step into it and to ask questions. To, if you're a social media person, to step into those Twitter spaces or LinkedIn, follow Rebecca and I and engage with us, to engage with experts across the field, but to engage as equals and engage as people who are actually building the future that we're all going to create. I'd encourage you to think about these issues not merely as technology or as ethics. These are questions that we're all going to face together over the next 50 or 100 years. And it means that whatever your vantage point, as Rebecca said, whatever your unique point of kind of entry into the space, know that holding these values of shared transparency, of fairness, of equity, of accountability in technology is something that we all hold together. So I just wanted to underscore what Rebecca said, and I want to invite you all to really step into your space to know that you're the architects of our shared future. Thanks, Rebecca. Back to you.
Thank you, Vilas.
Yeah, that's excellent. I guess I'll add, I said that was the last question, but I'll add one more just to kind of finish up. And there have been some questions in the chat that I've, we'll send you the chat afterwards. Yes, a lot of them there, but yeah, I guess there's been a few questions about how the students at BWSI get more engaged in this field and potentially more engaged with PGM directly too. Are there internships or opportunities there or other things that you would suggest the students are really, seems like there's a lot of students who are very motivated by this problem area and by the work that you all are doing.
Absolutely. Vilas, you may also want to jump in on this in terms of how we're building out some of our programming. But I will say this, as Vilas said, this is an area that is continuing to evolve. We're just getting started. We are also thinking about how we create greater connection points. And so I'll echo what Vilas says, connect with us on LinkedIn, follow us on work. This is where we start to, that's where we will announce initiatives that we're working on. We often amplify opportunities for students and fellowships, particularly those that are being driven by our partners in this space. So would encourage you to use that as a resource. And then I know Vilas and I both, every time we see good opportunities coming from our partner organizations, always try to amplify that. So we're doing our part to build that community. But Vilas, I don't know if you have other things you want to add to that.
No, I think that's great. I will just say not everything Rebecca said, and also we want to know what you all are working on. Like, share it with us on social media. I saw even in the chat, some of you are working on apps about increasing awareness of the SDGs. I think many of you, and I hope all of you this week, have seen the incredible images that have been returned by the James Webb Telescope. This incredible endeavor of humanity that brought together astrophysicists and data scientists and policymakers and everybody else. When those kinds of things happen, there are moments of incredible conversation. And if you're doing something with those images, as many folks around AI are now trying to apply them to those new things that are coming back, we want to hear about them. So let us know and let's see how we do something together.
That's awesome. And thank you both so much for spending the time today with the students. I know it's been incredibly valuable to everyone here, all the students online. I think I'll turn this over to Lisa now and Ayushi and Kasheki, to do the presentation of the BWSI t-shirts. Lisa, do you want to unmute too if you're online still?
Yep. Okay, Ayushi, do you want to go first?
Absolutely. Thank you so much for spending time with us, and really I feel extremely enlightened by listening to you speak, and everything you said was extremely inspirational. And honestly, I think the topics that you touched on and described and elaborated on, those are the topics for our future and what we really aim to work on. And especially with BWSI, looking at AI and technology, and I'm currently in the Metalytics course, so really looking at it in a data science perspective. And in terms of healthcare, I definitely see how, the projects you brought up and the applications, they really play a big role in everyone's lives, not just ourselves. So thank you so much for spending the time with us. I truly appreciate it.
Thank you. The pleasure was truly all mine. The questions that you all ask are exactly the ones that we are also asking. And I love that you are already thinking about that and are poised to be drivers of those answers.
Kijidi?
Oh yeah, thank you for providing us with a really insightful and detailed presentation, and especially giving us high schoolers insight on the real world field and how it actually is the real world. So thank you.
And we want to present you with the t-shirt, which I believe you have, Rebecca.
Do I get to hold it up now?
You get to hold it up and everybody smile so we can get the nice picture. And Joel will let us know when you can stop smiling.
Hold on.
One more. Okay, we got it.
All right, great. So thank you so much, Rebecca and Vilas.
Thank you all. This was really extraordinary. I'm walking away deeply inspired by the questions you're asking, the work you're doing. And as Vilas said, this space is new. And so inviting you all to bring it, the best of what you have to it and to help us answer these questions. I'm looking forward to working with you all on that one.
Yeah, thank you. It was a great briefing. Thank you so much.
Thank you.
Bye, everyone.
Thank you.
Thank you.
Thank you.
Thank you.
BWSI,
Thank you.
signing off.
Thank you.
Students, stay on.
BWSI, I see you all signing off.
Please stay on.
No, they're not.
But we are down to 2:59. Okay. Thanks.
Yeah, so we're gonna have to start doing announcements in the beginning. So
People are coming back in.
yeah, people are coming back in.
All right, let's just get going though.
Yep. So quickly, for those of you who missed it yesterday, this is a lunch meeting. So please, for those of you on the East Coast, bring your lunch with you. Feel free to eat, keep your cameras on. It's okay that you're eating during this meeting. We fully expect you to eat during this meeting. Second thing is, I'm noticing a lot of people have their cameras on, but they're blacking them out. Defeats the purpose of having your camera on if you black it out. So please, cameras on. It just shows respect to the speakers that are here. They're giving up their time to give you these amazing talks. The least we could do is have our cameras on and paying attention to them. It's okay. I watched throughout the whole meeting. Cameras go off and on. People are going to get drinks in the bathroom. Nobody's going to question if you turn your camera off for a few minutes and you turn it back on. But please try to turn your cameras on. No, West Coast lunch does not exist, but you can eat breakfast during this meeting. So West Coast, you eat breakfast. East Coast, you eat lunch. We're okay with either one. The other thing is there is a Discord page that a lot of people have signed up for cross programs. That is not an official BWSI Discord page. You guys are allowed to have whatever you want. I just want to make sure you know there will be no BWSI announcements or anything like that. There are no BWSI staff on it. So that is an unsanctioned BWSI Discord page. You're all teenagers. I'm sure you have many Discord pages. It's not up to us to monitor it. We're not monitoring that one, but it has nothing to do with us. We just want to make sure you all know that. Postcards and pre-programmed surveys are due by the 15th. You will start hearing from us tomorrow if you have not submitted them. Pre-programmed survey is very, very important. Surveys help us get funding. And so if you can answer those surveys, they really go a long way to keeping this free for all future generations. So they don't take very long. Please get them done. And I think that's it.
Sorry, I have a question.
Yep.
Where can we find the link to the survey and I mean, we already have the link for the postcard, but is the survey in the same place?
Yep, dashboard. Everything you need links to is on that dashboard. So anytime we tell you something is due, go to the dashboard. The links are there.
Thank you.
Yep. Anybody else have any questions? Great. We'll let you off so you guys can get to class, and we'll see you tomorrow for BAE.
Thank you.
Thank you.
Thanks.
Thank you.
Thank you.
Thank you.
Thank you.
Thank you.
Had a couple of people ask me what my background is.
Our very messy shop.
Is that just a picture or that's a real background?
No, that's a real background.
All right.
Because you have better service in there, right?
Yeah, and the other spots between the Division 5 guys and the Southampton group in that the other space was pretty crowded, so busy with stuff.
Yeah.
We need
So Dylan, Apramaya, if you were there, can you just turn on your camera?
I know you didn't say my name, but I'm here.
Oh, no, I was just saying you guys can disconnect and go to your classes or whatever you're supposed to be doing right now.
The games lecture starts at 2, so I'm just free right now. So I'm just staying here.
Yeah, so feel free to sign off and take a half-hour break.
Oh, hello. I just wanted to say, my sister and I actually missed this seminar. Yeah, we're really sorry. We're really sorry about that. Yeah. We thought it was at 1:30. So we ended up missing it. Yeah.
Okay, just make sure you pay attention to the schedule, and there is one tomorrow at 12:30, so we'll see you tomorrow.
It was,
okay, thank you.
It was a great talk. It will be posted on YouTube channel afterwards in a couple of days. You can watch. I think today's talk was really great, so you should definitely want to watch that afterwards.
Okay, thank you.
So Dylan, you should go take a half hour. Turn off your computer. Great.
Okay. Good.
Yeah, and putting people in the waiting room so that if we need to talk for a few minutes, we can.
Yeah.
So,
Well, this was good. Today's seminar was really good. I think we got lots of questions. Hopefully they start getting to the pattern, right?
Yeah, the questions were coming in fast and furious.
yeah.
Lisa, I'm waiting for Lou to give me a formal approval to share the abstract.
I think she just did, didn't she?
Yeah, we saw that in email
Did?
too.
Yeah.
Well, she said, but then she said, when I asked her how to introduce tomorrow, it's not what's in the bio. They're in this, right? They're in this problem, like announcement hasn't come out. So they're a little ahead